I'm Bob Jernberg. I'm 83 years old. I have been retired for 26 years. As far as hospice, my first introduction to hospice was really when my brother and his wife, my sister-in-law, were on hospice, and I began to see how positive the experience was for them to be on hospice and how caring hospice was. I felt that hospice was a wonderful organization, that they really cared for people. It's a lonely time for some people and that they really need someone there to visit with them, so I felt that was a good thing as far as volunteering. I had been working with hospice probably the week before. They come and volunteer for me in the picnics in the park. All of a sudden my jaw started to hurt and my arms started to hurt, and my chest. I called my niece to come and took me up to the emergency room. By the time I got there, I was flatlined. I had no pulse and no heartbeat, and they had to shock me back. And then I was in the hospital, and over the next 18 days, I had 17 pints of blood. Every day they gave me a pint of blood, and I spent 80 days on hospice, and it was a wonderful experience. I had nursing assistants to start with every day. In the morning, they'd come help me bathe, help me with things I needed for washing clothes or doing dishes and things. And the nurse came at least once a week, and I also a chaplain, and I really felt positive, and I got better, and then I went back to seeing a doctor, and I just feel so positive about what hospice has done, and I feel that every day is just a bonus day, and my outlook on life has changed. You know, I'm not worried about dying, but I feel every day the Lord has given me is another day to enjoy. And I probably enjoy the little things a little more. The care was wonderful. I think the care was almost beyond what you expect. People were careful. I had nursing assistants that would come in the morning and pick out my clothes for the day. It helped me bathe and get me going for the mornings, and that's because I was living at home alone. My kids were able to leave, and I was able to, you know, do some cooking and so forth and get by, and it was beyond what I expected. It was really, and not only that did they care, but they really cared so much that they became part of my family. I certainly want to continue to do volunteering, that was one, but I all felt I really owed it to hospice. I owed my life to hospice. HIA Hospice gave me comfort and care when I needed it, and now I'm able to give care and volunteering for others.